Welcome to the Social Work is Everywhere podcast, where we uncover the powerful, diverse, and far reaching impact of social work across the globe. We are your hosts, Dr. Lynn Murphy Michalopoulos,
David Robertson.
through the voices of the University of Maryland School of Social Work community, including faculty, staff, students, alumni, and global partners. We'll explore unique perspectives and innovative initiatives shaping the future of the field.
Each episode, we spotlight the practice, research, and experience of students and social workers from a wide range of industries and professions, from clinical care to policy change, from leadership to grassroots advocacy and community engagement. Social work is truly everywhere.
Today, I am very excited to welcome a dear friend and colleague that I've known for years, Dr. Simona. Dr. Simona is a lecturer in the Department of Social Work and Sociology at the University of Zambia, and also holds another title, which I will let him describe. So if you can tell us your other role as leading research at University of Zambia, and then just give us a bit about your background, that would be great.
Thank you very much for having me. As Lynn mentioned, we come from a long way. We call ourselves partners in crime. We have had some engagement for quite some time. I think it's over almost 10 years now.
Yeah.
So I think I'm well introduced. I'm Simona, and I am a lecturer in the Department of Social Work and Sociology, and also serve as the current assistant faculty dean in charge of research in the School of Humanities and Social Sciences. I have been a researcher for over 10 years now. I hold a PhD in sociology and quantitative social science methods from the University of Glasgow in the United Kingdom. And I teach research methods and sociology of health and medicine, and so many other courses. So I'm happy to be here, and I'm looking forward to our engagement today. Thank you very much.
Thank you.
Thanks for being here. I'm curious because I'm an invited student in this space. How did you all's collaboration begin, and what motivated your focus on community partnerships, Dr. Simona?
Well, thank you very much. I think, like I have said, our collaboration began quite some time back. It's around 10 years old. I think it's out of shared interest. I think the first time when I was introduced to Lynn, if I remember very well, it was, I think, the head of department who came to my office and said that, we have somebody who is doing research here in Zambia, and she's working on qualitative methods. I remember I had just come from South Africa with my skills in qualitative data analysis. Mm-hmm. And I think the head of department was aware of that. And he thought that I was the right person to be in this collaboration. So we met, and then we started doing some work together. I remember, I think the first, it was some research on fisher folks in Kafue, and then we did a bit on international truck driver studies. Yeah, and from there, we just went off to quite a number of things. I think we'll be discussing those as we go. But really, it's just some shared interests, and looking at the vulnerable communities within our country. And I think that, statistics show that, fisher folks are more vulnerable, to HIV risks and because of the nature of their work. Those vulnerabilities compelled us to focus on them, as well as international truck drivers, because of the nature of their work. So really, to answer your question, it's just based on shared interests to focus on the vulnerable communities within our country.
And you did also a lot of work with gender-based violence on a larger scale as well, right? Didn't you do multi-country work?
Yeah. So I think based on my other works, we really focused on GBV, gender-based violence against women in Zambia and also across sub-Saharan Africa. So I had a bit of that kind of background, which I was bringing to the table. And together with our unique backgrounds, I think we managed to create a very solid partnership that have lasted for quite a long time.
In your work, we've done a lot of work together with vulnerable communities, but then in Zambia and really try to partner with those communities. And so in your work, like how do you define community partnerships and kind of how has that looked like in practice?
Yeah, I think community partnerships could be defined in different ways. I think for us, it would really be some sort of relationships between researchers and the local communities, right?
Mm-hmm.
Community members, organizations, and other stakeholders.
Mm-hmm.
But I think the emphasis really is on research that is relevant,
Right.
to the local community, and research that is ethical, and research which is beneficial to the communities that are involved. So I think on that lens, that is how we can define community partnerships in our sense, the involvement of the communities themselves in really fostering solutions for their own problems, which really is going to push the research to become relevant and to become beneficial to the communities themselves.
That's really important. I mean, I think the relevance, the being ethical and multi-level partnerships with key stakeholders. So like with fisherfolk, but also community partners, government, I think is also important. One thing that folks may not know that I wanted to share, that Simona and I were co-founders of the Moving Well Project, the nonprofit that I founded before I came back to University of Maryland. And, we really focused on, I felt we really tried to be thoughtful about how we presented information. So even thinking about like the ethical approach and relevance approach, so really working closely with the fisherfolk, the chairman of the marketplace, and also how we portrayed information so that we weren't portraying information such as, oh, these poor fisherfolk, like they're also resilient as well and had strengths and, would know what would work for their community. So, and Simona was key in that kind of approach.
Yeah. Yeah, and I've done a lot of work in the Moving Oil project. And really, what was unique about it is that, we wanted the solutions to really work for the people.
Mm-hmm.
So sometimes I remember at some point we even used some very prominent psychological models. I think we were, trying to address mental health issues. But before we began the implementation, we made sure that we did a thorough job in terms of revising that model, which involved the communities themselves. So we had our research assistants staying in the community to make sure that, the voices of the people are included in the model that we were going to implement, make sure that the needs of the communities are captured. And then we did a thorough job to revise that international model to make sure that it is really relevant to the communities that we were looking at. And that really included having several series of meetings with the beneficiaries so that their voices are included from start to end. So that really is a very unique approach which we leveraged in our organization. And I think it has been quite a central theme in our research, from the beginning. This idea of having community participation, especially interventions that we were able to launch. And I think that has really been very, very important and unique for our organization and also for our research.
Do you find that that's something that's taught or emphasized within, teaching folks within Zambia, like students getting their master's, PhD, like even undergrad, that like community-based approach?
I was actually with a colleague to say that sometimes the thinking is that local researchers are very embedded in local communities, which is not actually the case most of the time. That's why you find that in terms of implementing research, which is community-based, it is not enough to just get some views from local researchers themselves, but also, what would be important is to really go in on the ground and have some interactions with the communities themselves. Because local researchers may not be very firmly on the ground. So you see, we do a lot of, we encourage our students to do such kind of projects where they don't only, get ideas from the lecturers or the instructors themselves, but to go on the ground and have some interaction with communities. So there are now a lot of upcoming researchers that are focused on community participation using participatory research methods that are really community centered. And especially those intervention-based kind of research that ensures that the communities have ownership to any kind of interventions that is brought to them, because without ownership, there's really nothing that can be done. So we still have a lot of work anyway in that space. I think that even local researchers and local lecturers who has a lot of work that needs to be done to make sure that community participation is encouraged, because I think that that's the way to go. If we have to bring in interventions that help and benefit the people on the ground.
Mm-hmm. Yeah, I mean, I feel like we struggle with that here in the States too. Many researchers struggle with that.
Dr. Simona, I'm curious, as a up and coming global researcher around global grief, is that what advice would you offer social workers engaging in global research who want to avoid extractive approaches?
Yeah, I think it's fascinating really to look at these concepts which are coming up, such as parachute style kind of research and extractive research terminologies, which are quite spot on when you look at the approaches that have been existing for quite a long time. So these are situations where you come in, you drop into a community, collect your data, and off you go. Without even having that shared experience with the local communities that are likely to be affected by your study. So this we should try by all means as a part of global research community to discourage, so that every kind of research that we may be involved in could involve local engagement, right? Could involve capacity building, could benefit the local population. And that is very, very important for global social workers that are engaged in this global research community. I think a few things that we need to bear in mind. One could be engagement with the community quite early in the research process, so that we don't come with a fully baked research project that has not involved people from the beginning. Because how do you know? Your project may not even be a priority for that particular community, right? Yeah, and sometimes we have this tendency of thinking that the local communities may not know what they want, but that is actually a fallacy, because they actually know what they want. But it's important to start early so that we can inculcate this equitable participation with the local stakeholders. And these stakeholders can involve maybe local researchers, because local researchers are closer to the ground, right? So they may know a few things that global researchers may not know. Involvement of institutions as well, involvement of communities, as I have said, not at the tail end of the project, but from the beginning. Even when you are coming up with research questions, for example, what areas are you going to focus on? It's very important that the local communities are involved from the beginning. And it's also important to build these genuine long-term partnerships. And I've already given an example of our own partnership with Lynn that has lasted for over 10 years. Why has it lasted for this long? It's because we respect each other. So we have trust, for each other. So we have cultivated this mutual respect, also shared responsibility over time. So that's very important. So you don't just come do one project and then you go, but you foster this sort of partnership, long-term partnership that is going to benefit both ends. And that may involve, the creation of MOUs, for example, memorandum of understanding between institutions, which we have done between UNZA and Maryland. So we have done that. So that fosters a long-term partnership, because you have a standing MOU between institutions at a very high level assigned by our vice chancellors. And that would include any kind of projects to involve schools, that involve departments. So departments do not have to create their own. It is already created at a higher level. And that means collaborations can take place between those institutions. So building long-term partnerships is very, very important. Trust between institutions. So that's very important.
One quick question, because it's burning in me in regards to there's a lot of humility that I've heard that needs to be really infused in this. And as a social worker, we are really focused on competency, but I'm hearing it's really a lot of humility.
Right.
Can you just give me a little bit of your lived experience on the difference between cultural competency and cultural humility?
I think that's, who said if you are not humble, you can't learn.
Right.
Humility fosters openness to learning, right? So it's not only me having competent in research methods, for example, but being humble enough to realize that there are some things which I don't know.
Mm-hmm.
And when I teach my students, I tell them that you should go into the field like an idiot.
That's awesome. I'm gonna start using that.
Yeah. You know some technical aspects, right? You've been to class, you've learned quantitative research, software,
Great.
but where you are going, you don't know. Sometimes you must assume you know, but you don't have that lived experience
Right.
that the people on the ground have. So in that sense, you are an idiot. And that is going to put you down. That is going to, that realization you don't know, is really going to humble you, right?
Mhm.
That put you down to learn from the people themselves who know about their own lives.
Right.
So they have solutions to their own problems, So what you need to do is to respect that and listen. I remember I did psychology as my minor in university. There was a course in counseling.
Mm.
And in my mind, I thought that counseling means providing solutions to the people. Like when somebody walks into the room, I read all their problems and I begin to dish out some solutions. So I was very sad, when I went to class in psychology to hear that you actually don't know anything. Even if you are a counselor, you must listen to the people because the people themselves have solutions to their own problems. So what you need to do, just provide some kind of guidance towards those solutions, but do more of listening than advising.
Right.
And for me, I was very disappointed at that time because I thought that I was going to gain these superpowers to really impose my knowledge. To impose this knowledge that I have on my clients, But it's not like that. People know, and we must respect that. Put aside a so-called competency and apply it when it's required. But as you are interacting with the people, you must do more of listening, and you require humility to do that.
Yeah. I think that the openness and listening is really important. I feel like I've been working in Zambia since 2012, and I learn every time I go. I think that's important. What do you wish academic institutions or funders better understood about the realities of engaging in this type of work?
Yeah, I think I will have touched a little bit of that. That is to say that we really cannot emphasize this more. The idea that we respect local knowledge. Come with that sort of humbleness and humility in our approaches to really make sure that we learn a lot and also involve the people in a participatory manner. Even as we are extracting knowledge, just to ensure that this knowledge is coming from the people. I'm sure you know in the qualitative space, in the qualitative research space, that why are you true? Because you are the one who is doing the interpretation, right? So you are collecting data and doing the interpretation. And now the question is, from what lens are you doing the interpretation? We are not saying that you have to involve everybody. You can do the interpretation, but important to get back to the people after you have done your analysis to see if what you have interpreted actually represents, whether your interpretation actually presents the views of the people that you interviewed. So that is very important.
Yeah.
Not only just extract data, do your analysis and publish in these kind of journals or Scopus and that kind of thing. It's really the idea of getting the data, do your analysis quite all right, and then go back to the people, try to engage with them and see if you are representing them well in your analysis. So I think that that's very, very important.
Exactly.
Dr. Simona, I know we're almost at time, but I just wanted to ask a question around hope. We're navigating some really ambiguous and unique times globally, politically. What gives you hope about the future of global research partnerships?
Yeah, I think this is a very good question. You know that there are so many changes which are taking place around the world. But for me, what gives me hope is the level of enlightenment that is there, whether it's on local researchers or on the community themselves. There is a lot of exposure today because of so many aspects of technology and globalization, such that there are a lot of things that we know about the global, for example, as researchers, and there are higher levels of exposure. So we know when we have an engagement that we have a stake in this. So if you're bringing a project, for example, you face a lot of questions in terms of the benefits that this project brings to the local communities. So in that sense, there is really a lot of hope in terms of the exposure that you find among local researchers, because there are a lot of activities that are going on. These are very well engaged researchers, so they would demand equal treatment, whether it's in the publication space, whether it's on sharing of resources, whether it's writing of grants. We have just wrote a grant with Lynn, and we had this equal partnership in terms of contribution to the research proposal itself.
Right.
So that gives me a lot of hope, because these are not people that would just for anything. They are going to demand what is due to the community, their communities, and what is due to them. And also just within the communities themselves. Now you have this technology where everybody has access to mobile phones, for example.
Right.
There is this financial inclusion because of different aspects of improvements in several spaces. So there are empowered communities in a sense. When you go there as a researcher, you're going to face questions. And they will ask about what is in there for themselves. Demand that you don't just use them to extract data. So this, what you have brought, what is it in for us? And what are you going to provide in terms of capacity building and enhancing their livelihoods? So they will not leave you alone. They will engage you. They will ask questions. They will demand what is due to them. So collectively, that is really what gives me some hope for the future. I think that there will be increased engagement in terms of equality. Also, there are some changes. I know that, for example, they will demand that you spell out aspects of equality across the globe. So, there are these realizations, even not only within our Global South research community, but also just across the world. There are several benchmarks that funders, for example, would demand from you if you are proposing a research project in terms of really emphasizing on this equality aspect. So that is really what gives me hope for the future.
Thank you, Simona. And one last question, another point that folks probably do not know about you, and this is especially to our PhD students. Dr. Simona is a guru in R. And is there any way that folks can be in touch with you or know where to find more information about all of your expertise in quantitative methods, and especially R, because it's something that there's not.
We welcome it in the School of Social Work.
Right.
No, I actually learned my R at the University of Michigan. I had a visit there some time back. But in terms of reaching out, I'm very active on LinkedIn. I've actually just published a book for students. It's called A Well-Rounded Student: Achieving Academic excellence and building life skills in
Okay.
university. That is, I have spent a lot of time really, and you find a lot of my stories there, just
Okay.
my own journey from a very poor village to the university. And hopefully it's going to provide some inspirations for young people.
Just to spread that around.
Yeah, so there's also another book in R which is coming up. So fingers crossed, I think the next few months it will finish. I love R and I've done a lot with it. So I decided I should write a book just to provide some explanation and a few things
Okay.
in there. Yeah. So I'm sure you are also going to indicate my email address. It knows everything.
Okay.
So when you post the podcast, you can include my name, my email address there. I'm free. Anybody can reach out at any time.
Thank you.
Thank you very much.
Thank you.
For those listeners who are listening and don't see anything, I just found Dr. Simona. It is Simona, PhD on LinkedIn.
Thank you. So thank you all for listening to the Social Workers Everywhere podcast. If you've been inspired by the stories and impact shared today, consider supporting the University of Maryland School of Social Work.
Every gift matters. Visit sussw.umaryland.edu/give to donate today. Choose other and specify global.
And to request more information about admission to the University of Maryland School of Social Work, visit ssw.umaryland.edu/MSW.
Thanks, Dr. Simona.